It's indeed a momentous occasion in that we have traveled and have conducted a number of events thus far in order to reach to this stage. The world wide over since March 11th have been in the grips of a pandemic, the likes of none, of course, that none of us have seen, but when matched against any, you have to date back to 1918 or thereabouts. It is not, in terms of deaths, it is not there, and we are here because we never want it to be there. So this is a very special occasion that we've had. This morning will mark the unveiling of the vaccination regime that we have to conduct as every country, every territory, every island nation throughout the world would have to conduct. And as we speak, over 107 million persons have been infected with the COVID-19 throughout the world. Over 2.3 million persons have died, and over 79 million, of course, have recovered. Here in the BVI, we have currently 8 active cases, and it is through the investments, it is through the hard work of a HEOC team, which was headed in the first instance by our permanent secretary, Patrona Davies, and our chief medical officer, Dr. Irad Potter, who I'm glad he was able to make it. We now have an acting CMO, Dr. Georges. We have an acting PS. And what is good about this is that it's a seamless transition. So it speaks of the brilliance of the civil service in terms of how they prepare persons to fit into the various roles. Our information officers all through have been tasked. GIS, they have been up with us 1 a.m., they've been up with us 7 a.m., and they've been around the clock. And Sister Adriana, she received calls on vacation. She said, "What vacation, Minister? You're going to call me anyway." So at the end of the day, it has taken a lot for us to be here. So during the grips of this pandemic, we've had challenges, yes. We have been second-guessed on some occasions and have been heralded in some occasions. But what did we have to do in order to get here? We had to invest so that we can have the lockdown after the March 11th declaration, and after our first case in March, we've had to do the lockdown, we had to do the food provisionings, we've had to look in terms of, we have now up to about 35 curfew orders. We've had a number of public health orders. We have a number of suppression orders, just so we can keep our territory, keep our lives and our livelihoods protected in ways in which we could be here today, sitting in a room. I wouldn't pull out my measuring tape, but sitting in a room so that we can have this conference. Other places cannot do it. We have to, more than all, thank God for the favors, for what He's done for us. We have to thank the people of the Virgin Islands for being cooperative during the lockdowns, during the partial lockdowns, and even as we have the 2 to 5 in terms of curfew, that they're cooperative in this, even as we protect our southwest borders, being cooperative, because it is important. We do not want to get to a stage where we have to go back to 24 hours or even 12 hours or 10 hours in terms of lockdowns in order to keep our people and our territory safe. So it is important, and as I've always said, that we've had to build our infrastructure so that we can have our testing facilities up on the 3rd level here. We've had to expand our lab capacities. So what we've had is this. We've had our lab capacity where we are certified. We are expanding our lab in terms of its physical nature, all because of the COVID and the COVID funds that were made available. We're expanding or particular isolation and or treatment facilities. We have our ventilators. We will add additional ventilators to these. These are critical infrastructure that we've had to put forward in terms of getting us ready. We've also had to look in terms of building the Welcome Center at the TB Letcham International Airport, where we are able to, we're the envy of a lot of airports because we have a beautiful receiving center where we can have the swabs done, people transported. We look throughout the world and they're now catching up with us in terms of the protocols necessary to keep the citizens safe. This is critical for us to understand, and because we are going to keep this at a level that is not going to be where we have 100 people positive and 200 people in the hospital. There are going to be a lot of criticisms as to exactly how long do we have to keep this. But it's critical for us to not get weary in well-doing. It is important for us to understand that as we get ready to be vaccinated here as a territory, I volunteered to be the first. The governor volunteered to be the second. And we have the honorable leader of the opposition volunteered to be the third. We have the minister for natural resources volunteered to be the fourth. And we have the member for the 4th district volunteering to be the 5th. And the speaker just walked in, he volunteered to be the 6th. So at the end of the day, it shows that we have confidence in what science has reported, in that we are confident that this will be not the all well and be it all. You still have to adhere to all of the safety protocols that we have. We have to make sure that this is done. Now, in terms of what we're going to be doing here and in the next few weeks, next few months, we have developed 9 centers outside of the hospital where we would be administering the vaccination. And for us to do this in an effective manner, it is important to note that record keeping, Dr. Potter, from the time I got here, he opined the fact that we're not the best at record keeping in terms of the data necessary so that we can have the information and the other PAHO and WHO and all of the other programs that we become a part of. So we're going to use this, and we took specific time in using this to make sure that we can get it done right. We have to have proper registration, we have to have proper information, and it must be complete so that they can use it, so that if there is a next pandemic, if there is a next mosquito-borne disease or airborne disease or any of the particular public health measures that we need to be wary of, that this could be done. So the record-keeping portion of it is as important. We don't want people just coming here and just being shot in the arm. So what we've done is that our 9 centers in Jocelyn Dyke, we'll use the clinic. At actually Capone's Bay, we'll use the clinic. Over in King Garden Bay, we'll use, we have agreement to use the church, Baptist church over there. At the Carvin Malone complex, we have a space there that we've donated for usage down there. At the multipurpose center, we have a site there. Up at the Fat Hogs Bay Seventh-day Adventist Church, we have a site that has been agreed to by the church. We have a site there. At the Valley in Virgin Gorda, we have a site. At North Sound, we have a site, and we're going to use the clinic. This will allow for us to not centralize the vaccination process. We have the staffing. We must be prepared to get the staffing done. We have a Salem cry out for those retired healthcare professionals, and a number of persons have called already and have volunteered their services. The private healthcare persons have also looked in terms of getting assistance to us as best they could. We will seek, after the volume of people are done, to get the private healthcare persons on board. They must be certified by the public health department so that the record-keeping portion of it is not lost. Because if you want to go ahead and get your card, you must be able to do this, and we want to make sure that this is done. So we've come a long way. In the last 2 days, the hospital have gone through the second conference with DNV in terms of the in terms of the accreditation, I understand that they've done extremely well in that. So even in the midst of this, we continue our accreditation process, and this is important for us to keep it on the cutting edge of technology that we have. So without going through the notes, I've completed everything that the notes had said. Just so you will know, the public healthcare professionals here at the hospital would actually begin their vaccination process tomorrow. On Monday, we have a whole schedule of the other private and the other persons that would go through the particular vaccination process. We have those, the essential workers, and you will have a full listing. I will leave the actual professionals to give you the full listing. The schedules are being made up. We have 8,000 doses. It is envisaged that until we know when the next tranche is coming, we would seek to do 4,000. If the other come next week, then another 4,000 will be added. If the others come, another 4,000, so that every person that takes one can get the other vaccination, the AstraZeneca. So, and we have we had planned early o'clock to be ahead of this. So we had actually contracted with COVAX in terms of getting a 20%, as the UK has indicated that they will do 80%. Now I understand that we may well be able to get the 100%, and whether it's 32,000 or 40,000, we will have that determination. But we had contracted early o'clock to get that particular allotment, and we are in the midst of getting that done. So as soon as they come, then we can add the additional amounts as we see fit. So, ladies and gentlemen, I think that it is a good day. I think that we are here because we must restore our lives, we must restore our livelihoods, and I think that the process we have done in terms of getting here, I think it could be one in which we have to take our hats off to all of the hard-working public and private citizens and all those persons who have adhered to all of what they had to do in order to get us to a place where we are today. Thank you very much.